Hello, Dr. Fisher here, and it's time to talk about results. What gives results after liposuction? Well, really, there are three things. The first one is the liposuction. That's why you're having surgery. And I'm going to take out all of the fat that you've got between you and your skin. If you're like me, after being 3 months inside without working and 24-hour access to my refrigerator, you probably got plenty of fat. So I'm going to take out everything you've got. I do need to leave a small amount of fat on the undersurface of the skin so that you do continue to look smooth. We don't want people to see irregularities and have everyone in the world know that you've had surgery. We want you to just look the best that you can. But I'm going to take out everything you've got. In the state of Florida, we can take out as much as 4 liters of pure fat. That is a lot of fat. For patients who have more than 4 liters of fat, a lot of times we'll send those patients out to lose some weight before surgery, or sometimes we'll actually do more than one surgery. But for the vast majority of my patients, you're already at that point, and I assure you, I'm going to take out everything you've got. Sometimes patients ask, if I'm adding my arms or I'm adding my inner thighs or other areas, does that mean that you're not going to take out everything from my waist? Well, I'm going to take out everything you've got from all of the areas that we're doing. If those areas are so large that we can't take out everything, sometimes we'll stage the procedure, but in the vast majority of patients, we're not taking out huge volumes from the arms and the thighs. We can get big differences with smaller volumes, and don't worry, we're not going to just sample a little bit of fat from all over your body and have you just look like a smaller version of your current self. So the first thing that we're doing, taking out all the fat you've got. That's my job. Unfortunately, there are 2 types of fat. There's fat that's between you and your skin. That's the stuff that I can get to with liposuction. And then there's internal or visceral fat. That fat is fat that's due to weight. Picture the stereotype of a construction worker, or picture Rick Ross. That's who I picture when I think about visceral fat, because he's kind of the poster child for visceral fat. Everybody immediately, when they picture him, they think of the way he used to look. He was a big ball with a beard, and he was like, "Rosé!" And now, have you seen Rick Ross lately? He doesn't look like that anymore. Kind of looks like this sad, droopy old man, but his stomach is pretty flat. It's a lot flatter. Rick Ross doesn't look like that because he wore a waist trainer, or wore a surgical garment, or wore a faja, or sweat himself down in garbage bags. It doesn't work that way. The reason that Rick Ross looks a lot better, has a much flatter stomach, and is a lot healthier is because Rick Ross lost a lot of weight. Now, I'm not telling you that you need to lose as much weight as Rick Ross did. The reason that I'm using this as an example is that most patients do need to lose weight after surgery to get the best result. Even 125-pound, 5'5" patients sometimes look a little bit better if they lose 3 or 5 pounds. And the vast majority of patients look better if they lose a little bit more than that. How much weight you need to lose really depends on your body. And the best weight for your body is really what you like when you look at yourself in front of the mirror. If you look at textbooks and you look at ideal weights and you look at the perfect BMI, that works for some people, but for most people, if they're at their ideal weight that the textbook says, they don't look healthy. They look older. It doesn't look good. So as you follow your journey after surgery and as you're losing weight and as you're recovering, you're going to look at yourself in the mirror, and at a certain weight, you're going to say, wow, I love the way I look at whatever weight you love, and that's the best weight for you. One of the most important things for seeing your result is giving your results time. You will see a huge difference right after surgery, no matter what type of surgery that we're doing. There are some surgeries where you see more of the result right away. A breast augmentation on a flat-chested woman, she's going to see a massive change because all of a sudden she's going to have implants. So there's a reason why we take on-table pictures of patients. They see dramatic changes right after surgery. But as many of you know, 3-4 days after surgery, when patients have swelling, they see less of a result. So it does take time to see a result, and your results will get better and better and better with time. As the swelling goes down, as the skin shrinks down, and as people go along that journey and get to the best weight for their body. So patients will look better 6 months after surgery than 6 minutes or 6 weeks after surgery. It does not mean that you're going to look horrible or you're going to look like a freak. It doesn't mean that you can't go to your cousin's wedding 3 months after surgery and see differences. But what it means is that patients get better and better and better with time. And those changes do go on for 18 months after surgery, a year and a half. Now, that doesn't mean that you need to wait a year and a half to see your results. Your results are relatively stable 6 months after surgery. Once again, a lot of the changes are visible even 6 weeks after surgery, but you will continue to look better and better and better with time.